Funding for This Is Nashville comes from you, our listeners, and Music City Prep Clinic, Nashville-based provider for PrEP and offering comprehensive sexual health services in an environment designed to be safe, professional, and shame-free. Learn more at musiccityprep.org.
I'm Tasha A.F. Lemley, and this is Nashville. Welcome back to our second season of In My Place. This special series educates listeners on what communities like Nashville can do to prevent and end homelessness, while still caring for our neighbors who are still unhoused. Over the course of 9 monthly episodes, we're learning about what it feels like to access services and weave through our local homelessness and healthcare systems on the path to housing. We're discussing what services work, what resources are missing, and what ideas our guests have for improving access to help. This series was created thanks in part to support from the Community Foundation of Middle Tennessee. In our first 3 episodes of this season, we've talked about what the first point of contact is like between someone who's experiencing homelessness and someone who could potentially offer help, and then how they build trust after that point, and then all that paperwork. So today we're talking about the waiting period. That's that liminal space after applications for housing and services have been sent in, but before there's word back. Welcome to the show, Meredith McLeod-Jolin, Executive Director of Shower the People.
Thank you.
So Meredith, what is Shower the People?
We are a mobile shower facility. We have a school bus that we've turned into a mobile resource hub. We provide showers, laundry, and hygiene supplies to people experiencing homelessness.
That's amazing. And so can you explain why that kind of mobile service is a need?
Because our folks spend so much of their days trying to run around and check the boxes of getting their meals, getting their appointments. And we wanted to make sure that they didn't have to come find us, that we would come find them and make it a really easy way for them to access our services.
Are there not showers and laundry facilities available at some of these other places where they're getting food and doing other things?
There are only 15 shower stalls available for everyone experiencing homelessness in Nashville, and most of those have very set times. So they're open really early in the mornings, or they are on one side of town. So we try to make sure that we are covering those gaps without those brick and mortar places.
So you're saying 15 shower stalls in Nashville. So it's like you're mobile. So other than you guys, there are 15 shower stalls in our entire community for all the people who are living outdoors.
Yes, and that's total male and female combined.
How many people do you estimate we have living outdoors? I know that's a loaded question.
It is. It's such a loaded question. I think it really just kind of depends. I think people that are living out on the streets, there's thousands. It's more than we've been able to calculate, especially in a pit count. So
okay. Well, thank you. Mm-hmm. Thank you for that. You guys are frequently seeing folks that are in this waiting period, I would imagine. So what are your clients waiting for?
All sorts of different services. Most of them, it's a housing related service. Some of them, it's healthcare or a rehab bed to open up. It just kind of depends, but most of them, we've gone through the process of trying to get housing, and now we're waiting for our name to come through on a wish list or a case manager to reach back out or something like that.
Like, so in the folks you've seen most recently, what are some of the things you're saying, oh gosh, like if I could snap my fingers, this service, I would want more of this today?
Case managers, somebody to actually hold our folks' hands and be able to walk them through the housing process. We have a lot of housing navigators through that OHS has been able to fund through different grants, but those people are just putting folks into the system. Once you're into the system, you have no idea what's happening. So to really have somebody to not only help them fill out all their paperwork, get all their documentations, but also attend the meetings and advocate for them to be a good resource in housing. Those are all really important, and we just don't have enough. We don't have enough case management capacity to be able to help those most vulnerable folks, the ones who you can't just give a website to and know that they're going to go to it, the ones that really need you to walk step by step through that process with them for them to end up with keys in hand and kind of stay with them through that.
So our producers are checking in regularly with unhoused people living across Nashville. We're going to hear from Irene, and she lost her house in 2023, and she's still staying in her car in West Nashville. We asked her what it's been like to be in that holding pattern and waiting to get back into housing. So let's hear from Irene.
Well, I did just get approved for disability. I'm not sure how long the timeline is, but I've been hooked up with mental co-op. I talked to the lady last week when I sent the award letter, and I talked with her again yesterday, and she still had not uploaded it. So I think there's a backlog of things because the systems are running so slow, and that's another worry. It's because things are so slow, how long it's going to take. I don't trust hardly anybody. I mean, I've been hurt so many times and lied to so many times, and I've fallen between the cracks so many times. Even with falling for my Social Security, I found out that my caseworker that was helping me apply through the SOAR program was fired. And along the way, she had missed a lot of my stuff, and if I had not been diligent in following up with people at Social Security when I would get letters saying they needed this and need that, and she had told me previously that it was already turned in, I didn't need to worry about it, but I'm still getting letters. That creates a real big problem. I worry a lot about other people out there who are not able to realize that something's going astray and knowing how to fix it or finding somebody who can fix it. So I know I'm falling through cracks just a little bit. I just wonder how many other people have fallen through the cracks, because how much did she miss in other cases, and did any of those people get denied because she messed up and didn't do?
Okay, so I would imagine some of our listeners are thinking the same thing I'm thinking. Like, we've all experienced, sitting in our homes, we've tried to get a new service turned on, or we're waiting on the cable guy. Do we even do cable anymore? I don't know. But we're waiting on, someone to come work with our internet, or, any number of things. Get our HVAC fixed. We're in a home. We've got our sandwich. We're frustrated. Here we've got Irene. This is someone living in her car and dealing with a lot of the same things, but these are life-saving things she's dealing with. So Meredith, oh my God, when you hear what she's dealing with, what comes to mind?
It's not surprising, especially that lack of trust. That's the biggest thing that we see is people will get promised the world of, I'm going to do this for you. And a lot of times the outreach worker or the case manager really believes what they're saying. They really believe they're going to get them into housing. They really believe they're going to do all these things. But then they had 75 other people added to their caseload, and they couldn't follow through on it. But that communication's not happening with the client. So the client still thinks they're getting the world given to them, but yet there's no way the case manager could do that. And so that communication piece is pretty consistent across the board of, we're doing everything we can, these case managers, but there's also crisis that they're trying to put out and things that they're really trying to manage, like literal life and death situations. I'm sure there are case managers and outreach workers that are going to tents and finding their clients in really rough shape and having to then, we were going to do this paperwork today, but now I'm having to take them to the emergency room because they're not going to get in the ambulance. And as soon as they say, I don't want to go, the ambulance is going to say, okay, bye, and leave. And so really being able to have those communication pieces and not keep breaking our folks' trust. When the trust is broken, that is where you get the people that say, I don't want housing, because they've been brokenhearted so many times. It's the same people that say, I don't want to get married because their last marriage was bad. It's that same thing with case managers.
And I think that's a really important point you bring up. So as we hear some of the complex frustrations in some of the clips we're going to hear today of people who are still unhoused, I think it's really important to keep in mind that for the vast majority of case managers and outreach workers, these are extremely skilled, talented, and compassionate people. Otherwise, they wouldn't be in these jobs. Thank you for bringing that up. And it's so important for our listeners to know that we're not talking about people that are halfway doing these jobs. It is just that difficult all the time, the time. If you're just tuning in, this is Nashville, and I'm your host today, Tasha A.F. Lemley. This is episode 4 of In My Place. It's our special series focused on finding the solution to homelessness. Today, we're talking about the waiting period. That's that liminal space after applications for housing and services have been sent in, but before there's word back. I want to welcome Kenna Hostler. She's the Homeless Outreach and Wellness Services Director at Park Center, a local nonprofit specializing in mental health, substance use, and homelessness. And also welcome to Stephanie Hughes, a Senior Outreach Specialist with People Loving Nashville. So thank you both for being here with us.
Thank you.
A couple episodes ago, we focused on building relationships between clients and service providers. And Meredith has been touching on that some, like how hard it is to build that trust and how understandably easy it is to break that trust. And Stephanie, do you hear similar complaints to what Irene said, what Meredith is saying about staffing changes?
Oh, definitely. every single new person that I'm working with, somebody will tell me that they had somebody that came by 3 or 4 months ago and they haven't seen them again. So that's kind of what I face every single time I work with somebody new.
And how are you responding to them?
Just like, I'm not the same as that, and I will show up for you. Even if it's not the same day, I will be there at least within like the week or two.
That was one of my things, when I was an outreach worker, that I thought, if the only thing I ever achieve at this job is to show up when I say I do, or do all the acrobatics it takes to get the person the information that I'm not coming, and why. And so how have you managed to do that? And have you failed?
Oh, I'm sure I've failed. It's just keeping consistent, and just like even if I don't have information or an update on anything, like I'm still going to show up in community with you and just be a person that like you can actually rely on, even if we're doing this for 6 months or 6 years,
So Kenna, you're overseeing a program at Park Center called SOAR. That's SOAR. And this is the program that connected Irene in our clip with disability benefits. So
Correct.
What in the world is SOAR?
So SOAR stands for SSI, SSDI, Outreach, Access, and Recovery. The way that I explain it best is it's the fast track to getting disability for those who have mental health diagnoses. Typically, to apply for disability at Social Security can take anywhere between 18 to 24 months. And people have to do that independently. And it's a lot of, it's a federal government paperwork. So very confusing. So one of the things is that SOAR was created to look specifically at those who are at risk of homelessness or experiencing homelessness with a mental health diagnosis, because we understand that that is a very vulnerable population to get their disability benefits faster. So the goal of SOAR is to get an approval within 90 days. So last year, Park Center SOAR, we had an average days of decision of 93 days with an approval rate of 93%.
You guys.
Yeah, it takes a lot of work. Hearing stories from Irene, it's hard as a service provider, because recently I was just looking at some data in regards to behavioral health, and the turnover rate right now nationally is about 28% for behavioral health providers. And I think it's just because of some of the work. I always tell people that work in my department, not only are we working in homelessness, but we're working in mental health and substance use. So extra barriers on top of that, trying to make sure people can get to their mental health appointments. And what SOAR does is really try and partner with people to make sure we're getting people's medical records. So one of the biggest barriers in disability is access to someone getting their own medical records. Most hospitals will charge you for your medical record. Because we're a nonprofit, we're able to get those records for free.
Oh, that's incredible.
So typically, any provider, like a hospital, they'll charge you 10 cents a page. And if you've ever been to the hospital, you know how much paperwork you get just in one discharge plan. So that's a really big barrier we're able to overcome for people, of pulling all of their medical records and helping them with the process. So we do the application for them, with them, to make sure that everything gets done. But to Meredith's point, you're also working on the caseload. You're also trying to manage different emergencies that come up, and turnover does happen. So it can just be a difficult thing to overcome sometimes.
I had heard in the past that applying for disability, people will get turned down an average of like 3 times before they're approved. But you guys are getting like a 90-something% success rate. Is that on first application?
Yes, that is on first application. So in Tennessee, if you did not know, Tennessee is actually the #1 SOAR state 2 years in a row. So that's beyond just us at Park Center. That is just Tennessee as a whole, for people really working on getting really good applications and getting those first approvals. Which is just a difficult thing. Obviously, we're seeing some changes in that lately, but overall, that was our last year, which we're really proud of. And as long as we can get more than the state. So I think it's important for people to know that with the average 18 to 24 months of a disability application for a non-SOAR case, the approval rate of first application in Tennessee is 30%.
Oh, my goodness.
So most people are having to go through that 18 to 24 months and get denied, then appeal. And there's a process for appeal and time that you have to take. So then you're waiting another 6 to 8 months for that. So if we're able to work with people, what we kind of say in Tennessee is, hey, if a SOAR program is willing to take your case, we're pretty likely that you're going to get approved. which is a really good feeling to have with people. But to what we've all talked about before, it's never a promise. What we tell people is, hey, we do good work, we do solid work, we're going to do our best and make sure that you have the best chance possible to get an approval.
How are you there? How can SOAR be there for people during not only the application process, but that waiting period?
I think one of the things that's important to know is that when you're working with people on housing and they don't have access to income and they don't have access to insurance, that SOAR is a way, we call it the stepping stone, right? Because we're not, in Tennessee, we're not a Medicaid expansion state. So the only way to get Medicaid is to be pregnant, to have a minor child, or to be disabled. So when you're working with people and you're working on their housing process, SOAR is really something that you can do in that in-between of housing to help people have a more stable chance at housing later on. Because we do know that as you're doing your applications and you're looking for housing, there are going to be things that you're going to need to be able to afford while you're in housing, not just rent, but utilities, your food, getting your bus cards, all of those things. And so that's what we think of as SOAR being a support to that of, hey, you have to wait X amount of time for housing. Well, we are going to try in 3 to 6 months to get you approved for disability. So at least you're working towards something that's going to get you insurance. You have better medical care when you come into housing. So you have income to be able to afford your rent and other things. And beyond rent, I like people to have access to income so that they can do things like buy something for themselves, because that's something that when you're having to be in survival mode, you don't always get to do something for yourself, right? Which I think sometimes we who are able to work or already have access to income can forget. I get to go and buy this thing because it makes me happy, and that's what I want people to be able to have access to do. So that's one way that SOAR can help. Another thing is that we work with people, whether they're still in the Nashville Rescue Mission and shelter there, whether they're in encampment. We work with people at risk of homelessness as well, which I think is definitely something I like to let people know, because there's not as many programs that will work with people in that gray area where you are pending an eviction, or an eviction is upcoming, or you're staying with family, but they've told you can't stay more than 30 days or 40 days. We can work with people in those situations. So we don't only have to have Category 1 homelessness in SOAR, which I think is also a really good thing to think about to try and work on the prevention angle as well. So
thank you. So recent federal administrative cuts have affected offices like the Social Security Administration. Have you seen a change in the time it takes to receive a decision on SOAR?
Yes, we have. So typically for SOAR, the goal, as I said, is a 90-day turnaround. And that's from dropping your application off to start your application to getting your decision. With the cuts, our Social Security office is at the staffing level of the 1970s. So they're at one of their lowest employment staffings. They're also on a hiring freeze. So
that's a nice combination,
isn't it? It's a great combination, especially when you're trying to make sure that you can get things through, especially when we are in a booming economy, to have both of those things happen at the same time. So definitely with that, of them being on a hiring freeze, they've also been ordered back in the office. They used to be remote, so we had to experience the transition of people moving in office. They're not able to work from home. There are lots of things with that, but one of the things we notice is our typical 90-day turnaround. We've been told by Social Security to expect 190 days instead.
Oh, okay. And Meredith, we've also heard cuts have had a severe impact on Shower the People. So how is it affecting your services?
So we don't receive any direct federal funding for our programs, but we did have 2 AmeriCorps members, which made up 50% of our staff. And we got a call that Monday evening that they were going to be cut Tuesday morning. And so not only did we lose 50% of our staff, but our AmeriCorps also lost their education allowance that they were working towards to go to college next year.
Oh, I'm so sorry. Yeah. So we're going to go to a clip from Daniel H., and he's with The Contributor. He's got an apartment now, and he's trying to help other people who are still living on the streets. He's got some thoughts about how people could access services faster. So let's hear from Daniel.
The problem with Nashville is it's so overgrown and so large that finding what you need in services is almost impossible, because offices are spread out so many different locations throughout Nashville, whether it be driving offices or legal offices or services. Departments are so spread apart. I think that what needs to be done is they need to have a centralized room or location, and you can go through the procedure of going from healthcare to mental health to whatever services that you need, because the problem is that people give you the runaround. When you call these offices up, now you have to wait 8 hours on a phone just to get somebody on the phone to even talk to you, even if they won't listen to you, because they're giving you excuses that they've been told to give you to get rid of you because they don't want to have the time to work that issue out. And Nashville itself is the problem right now, is that finding people when you're poor to advocate for you is almost impossible. So we're only asking for one thing. We're asking for the simple services of placing together an office space that will allow us to go in and access every single service, no matter what our financial resource is or who we are, that we are entitled to it.
So Daniel's wanting to centralize services to one location, and I think we've all heard that quite a bit. I've heard this quite a bit over the last 20 years, that services are too siloed and that it's physically hard to get from one to another. There's just not enough time, or my body and mind can't function at that level. Stephanie, it sounds like this would likely shorten wait times for people and could make the process not only easier for those accessing the services, but providers as well. Is there any hope?
I would like to say yes, but no, I definitely can totally hear what Daniel's saying. As far as like getting even access to a bus pass to get somewhere, and then also having to walk that certain distance. Like if you're in any sort of like physical, disability, like that's going to be nearly impossible to like navigate your way around town, like on the bus system, and then having to walk whatever distance from the bus stop to the said building. So, I hear that all the time. So,
what about things like resource fairs? And so resource fairs, could one of you explain what those are? Are they any good? But I'm getting an idea. Like we've got.
I'll say it.
Yes.
It's fine.
thanks, Meredith.
Yep.
Here comes Meredith.
I think resource fairs, as the idea of them, are excellent. I think that they have not been done in a way that is super helpful for the folks that we're serving. I think they're done reactively instead of proactively. So we're bringing them to spaces that we are already working to close the encampment or things like that. Instead of bringing them to new spaces where these folks don't have the services, they're being held in a lot of places that are over-serviced. So they're not necessarily reaching people that don't already know the services. So from my experience, I think like I said, I think they're a great idea. I just don't think they are executed in the way that's the most helpful.
And just very briefly, my understanding of resource fairs, it's kind of like getting a bunch of service providers into one place at one time, like in a gymnasium or large room where someone can apply for different things, meet different people from all kinds of services. Is that fair?
I think it's usually not even applying for things. It's usually learning about what they can go to that person's office to apply for.
Okay.
So it's basically an information booth, but not necessarily a service booth, if that makes sense. So I'm telling you that I can do these things, but I can't do them here. You need to come to my office and make an appointment with me is kind of what's going on.
I would absolutely agree. I think it's dependent on what the organization can do, because if you look at resource fairs, you have to look at frequency as well as staffing. So I think about it from my organization. We do participate in resource fairs, and I try my hardest to make sure I have someone who can do direct admits there for our programming for SOAR or street outreach, but that they also have their caseload of people they're supposed to see. And so if there's a resource fair that needs to be attended for a 4-hour block every single Thursday, any day of the week, that's going to be time that people have to figure out, how can I do that? There are times where I'm going to have my business development there to help, so that way I can have sometimes where there's caseworkers and sometimes when there's business development. But I think that is part of it too, is it's depending on what can that organization provide in that space. Can they provide someone who does direct admits? Because there are some organizations where you can't do a direct admit. I'm thinking Mental Health Cooperative or Centerstone. They have a intake process that has to be completed by the phone just due to the amount of what they need. So that's not something they would necessarily be able to do on site. So to Meredith's point, it does become more of a, hey, you can call us kind of thing.
Here's my business card.
Yes.
Well, we need to take a break. And when we come back, we're going to talk more about the emotional impact of this waiting period. So stay with us. This is Nashville.
Funding for This is Nashville comes from Burr & Foreman Law Firm, serving clients with transactional, litigation, and regulatory needs. Discovering how each client defines a win and working with them every step of the way to achieve it. Burr.com. Funding for This is Nashville comes from you, our listeners, and Music City Prep Clinic, Nashville-based provider for PrEP and offering comprehensive sexual health services in an environment designed to be safe, professional, and shame-free. Learn more at musiccityprep.org.
How long must you wait for it? How long must you pay for it? How long must you wait for it?
I'm Tasha A.F. Limley, and this is Nashville. This is episode 4 of season 2 of our special series, In My Place. It's a series about finding home in Nashville, brought to you in part thanks to support from the Community Foundation of Middle Tennessee. We are back with our 3 guests, Kenna Hassler of Park Center, Meredith McLeod-Jolin of Shower the People, and Stephanie Hughes of People Loving Nashville. We're talking about the application limbo, what it feels like to wait around for responses. So Stephanie, you're working with people who are constantly in some way waiting. Do you even have a typical day?
I do not. It can be just incredibly undignifying process to be put on a wait list and not know where you stand. So that's kind of where I come in, and I just try to instill hope and just keep that person in the know, and then also just try to be really annoying with how I follow up with apartment complexes and applications. And
How many people are you working with, do you think?
Right now I'm between 30 and 40, and that can vary throughout the week. And
You
throughout
yourself, 30 or 40?
Yeah. And that's from people that just come to our Monday night outreach to people that I'm really diving in with on housing and just supportive services.
So our producer, Judith Tackett, recently spoke with Patricia, and she's a young woman that Judith met next to the We Go Central location in downtown Nashville. Patricia's got some frustration about the effort it takes to just get through her day. So let's listen.
I'm wanting to get off the streets. I'm wanting to have, my own safe haven in a way, or safe home, where I can go and lock my door and I don't have to bring all this stuff. I had 8 bags on me yesterday before I got the duffel bag. I was carrying it all by myself. And I have a fiance, but she's currently not here right now. It's not just my stuff, it's hers as well. And when you want to find a safe place to hide it, there's not really any safe place to hide it. So when you're wanting to get off the streets and into housing, and they're taking their sweet precious time with that, it's getting frustrating. It's okay, I asked you, how long is it going to take? And if you can't help me, where can I go to get help getting into housing quicker? And they can't even help me with that. It's I want to put my stuff somewhere safe where I don't have to carry it with me 24/7. Because that's what I'm doing right now, is carrying this stuff 24/7, and it's kind of killing my body in a way. I have food, snack foods. I have that, drinks. I usually carry a couple drinks, clothes, blankets, anything that I can get that a person who's on the street needs. That's a necessity. Clothing, you never know, you might need a spare outfit or two. I have that in there. This backpack has snack foods, chips, candy and stuff like that, and water. I'm always carrying water with me. Say if someone doesn't bring food, there's a couple people that drive by and ask if you're hungry. If you don't get that, it's okay, I have snack food that I can munch on until I go to a place that serves dinner or serves lunch or breakfast. So that's basically what's in these bags that I carry with me.
So Meredith, when you hear Patricia's frustration, what comes to mind?
It's so common, especially the bag situation. And then people will start to put you can't bring any bags in here, and anyone with large bags can't come in. It's there become very targeted policies because of that. And it's so common. And the only resource that I've seen to be able to take people's bags is like, yeah, let me keep it for you. It's going to go stored in our basement. And if you want to get to it, you have to come and talk to a staff member who then has to escort you down to your belongings. Or we're going to put it in a storage unit and you need to contact us a week before you want to get it. So that way we can make sure somebody can get it. So it is a huge problem. And it creates a lot of distrust as well, because if we're asking people to put these belongings here and then they're going missing, or they're asking them to give it to us and people are not responding to those calls, it's just another tick against us of, we want you to trust us, but we're doing things that are not building that trust.
So Shara, the people, you guys, like you said, you're a small team. How many people? Two.
No.
And you're focusing on helping people survive during the waiting period. And you make referrals to other service providers.
Yep.
What do you do when you feel like people are not getting what they need and your team doesn't have the bandwidth? Because you don't.
No, we don't. I send a lot of direct text messages to executive directors and say, hey, this is what's going on. Either you can fix it or I'm going to cause a scene. And so that is a lot of times how things get fixed, is because you call them out. A lot of times the people who are doing the outreach and the people who are making the decisions are not communicating with one another. So the things that are being told as a employee is not what's being told out into the environment. And so making sure that people are aware that this is what's going on out in the real world, and it's a huge issue. And we can fix it as a team and really help these folks, or we can not be a team and I'm going to advocate for the folks. I'm a licensed clinical social worker. I'm held by that code of ethics, and that is more important to me than somebody being mad at me for calling them out on not doing their job.
Man, you're such a fierce advocate. So Stephanie, you're experiencing a really rough time with one of your clients, Denny. Mm-hmm. And I think, is he who you were talking about earlier?
Yes.
And he was invited to the show today, and he really wanted to come, but he couldn't because things are just that rough. He's got a severe disability, he's homeless, and he shared with our producer that he wants our listeners to hear about his experience waiting for housing, even though he couldn't be here. He's hoping to be indoors before this winter, and he's getting sort of scared that that's not going to happen. Can you share what's going on with him?
Oh, yeah. The reason he couldn't be here today was due to the location of where he's been staying. Without giving away too much, he has been staying outdoors, obviously, and the place where he felt safest because his vision is failing him. They have decided that they are going to be doing construction and taking down the one shelter that he would be able to sleep under or feel safe from, like rain or the elements. And so they're fencing all of that off, and now he just is facing even more unknowns as we wait for housing or any of the applications to come through.
So with Denny, we're talking about not even getting to stay in a car. Is Denny legally blind?
He has severe cataracts. I was finally able to access a doctor that we didn't have to wait on a referral from. And so the doctor said the cataracts are very extreme. So we're just, waiting.
So does it look like he's going to be able to have a surgery?
We are waiting for an additional referral for surgery. Or for a consultation to next steps.
Is cataract surgery something he could do while still unhoused, or does he have to wait for his housing to come through before he can get the cataract surgery?
Yeah, that's also a question that we have. But once the surgery does happen, we would step in to take care of him, like for however many weeks, whether that's hotel stay or something like that.
And we've talked about respite care, and I think we'll talk about that more later in the series, but we've talked about it a little in previous episodes already, which is an amazing, and we don't have enough.
Yeah.
So these liminal spaces or these waiting periods while folks are trying to get housing, they don't just affect the person experiencing homelessness. I think you guys can hear it also affects these advocates that are sitting here with me today and the wider community around them. So let's hear from Irene again. And again, she's staying in her car and has a worry I'm guessing most parents can relate to.
The waiting process also includes my kids. My son asked me, and he was 15 at the time, okay, you got a place yet? Have you heard anything yet? Almost every day he would ask that. And I've been out here so long now that he has stopped asking that. So now that the process is almost over, He's worrying now whether I'll find a place that's decent that I can bring him into. It's just not what your normal person would worry about when you're out here. There's so many things to worry about. So I know I've gotten through the paperwork and everything, but I still have a waiting period because I've got to find a place and then acclimate to it, get all the paperwork in order with it before I can finally move. So that's where most of my worries lie. Very sad, very depressed. Every day I'm crying several times whenever I think of my kids and the situation they're in and the love they're not getting because they're not with me full time, and they should be. That's the hardest thing.
Kenna, do you hear clients talk about their kids a lot?
Yes, it is something that we hear a lot when people, typically in my program, talking more about relationships with their adult children and what they've already missed out on and trying to get to a place where they can be with their grandchildren or build relationships back with their adult children.
Meredith, where do children tend to be when a parent is living outdoors?
I think it kind of depends on their support system. So a lot of times it's with a sibling, like the person's aunt or uncle, the children's aunt or uncle, who maybe is stable, a grandparent who maybe is stable. If it's only one of the parents experiencing homelessness, they'll be with the other one. But otherwise, there are some incredible resources for our families. So we don't necessarily come across them very often in the encampments. We'll see some people who are maybe sleeping in their cars and want to be able to come shower with their kids. But because of the CPS thing, we don't have a ton of like young families. I think I have 2 small children. I have a 10-year-old and a 5-year-old. So I think kids get brought up to me a lot, more of a let's bond over our kids. Let me tell you about how my kids were doing this when they were their age. So I hear a lot about it just from that perspective. But I think a lot of folks are also very ashamed of where their situation is, that they would rather their kid think they're in jail than homeless. I've had a lot of men say, I've gotten out of jail and I haven't told my family I'm out because I don't want them, I'd rather them think I'm safe in jail than to see me out on the streets. So that's kind of where a lot of our folks are coming from.
And CPS is?
Child Protective Services.
Thank you. Mm-hmm. Thank you. Kenna, we have just a few minutes left. And can you talk about the frustration you guys feel alongside your client during these waiting periods?
Yes, I think when we talk about doing this work, and I recently was just talking about this with my team, no one would want to work in homeless services and be outreach workers and work in social services unless they wanted to help people, right? And sometimes you end up in a situation where, as the clip we heard earlier, can I get housing faster anywhere? And the answer that we have is no. This is the process that we have, and you want to be able to give someone what they need, right? I think everybody knows that there's a Maslow hierarchy of needs, and there's really hard times to get all the other things done if you don't have your basic needs of food and shelter met. And that's where we, not to get emotional myself, but get frustrated as a provider because you want the best for the people that you serve. And sometimes there are things that are just out of your control, even as a provider who understands. And I always remind my team and have to remind myself of, if I'm frustrated, I can't even imagine how frustrating it is for the people that we work with, because here I am getting to sit down with providers and, I get to see the chart of how everything's supposed to work, and I work in the system. How frustrating it is for someone who I'm trying to explain that system to, and they're also saying, Kenna, I just need food.
Yeah, they're hungry or they're in pain.
Yeah, they're hungry, they're in pain. When we work in SOAR, we're talking about people who have some of the most severe mental health diagnoses who are outdoors. And we're having to say, I'm sorry, there's no update yet from Social Security. I'm sorry that there's no update yet. I'm calling, but there's nothing there. And I do think that something that we can do as providers. So one of the things I changed for our SOAR program is we do have a wait list for SOAR, but I call it a service-driven wait list. So on my wait list, there is a worker who the wait list is her caseload. So I don't have a wait list where we say, okay, you're on the wait list. We'll call you when it gets there. I have a worker who staffs our wait list, who she says, I'm your caseworker while you're waiting to get to your SOAR worker. I've made sure to train her. She can get birth certificates, IDs, Social Security cards, food stamps. So people can be working towards something even while they're waiting for
on the
SOAR.
big thing. Yeah.
Yeah. And so I think that is something that we as a community could do more of. Because when I came up with it, I was like, wow, why didn't I do this years ago? But it just even that to say, yes, you're waiting, but I'm still going to be here and talk to you. And she sees people on a weekly to bi-weekly basis as a wait list. And I think that's what we have to think about is how can we do more things like that since we know there's a wait. I always use the analogy of like, for people who are listening, how many times have you been in line, whether it's for behind at the ATM, and you know you have to go to the ATM, and there's 10 people in line with you, and you're so annoyed that you say, you know, I'm just going to leave. The people we serve don't get to leave, right? Or if they do leave, they have to start all over. There's not another ATM that they can go to, right? So how do we make it, right? When you go to a festival and you have to wait in line for stuff, you're like, oh, well, you know, I can go get food. I can go do these other things while I'm waiting in line, or I'm getting entertained by something else. So what can we as a community do while people are waiting to make sure that we're still serving the other needs that they have, or making it so that the wait is still as engaging of, hey, I'm still here.
Thank you so much. I really appreciate that. Like while we're sitting in a waiting room, you know, at very basics, we've got magazines sitting there in the doctor's waiting room. So what are something we can work on in the meantime? Thank you. So Stephanie, before we end, what supports you? Like, where are you getting your support, and how do you keep going?
Gonna cry. Hold on.
It's okay not to be okay.
We have a really incredible staff. And it's just like the backbone that I need to like just keep going. Because we hit so many like hopeless situations, or it feels so hopeless. But it's just not only do like people that I'm working with need community, but I need that community too. And so having just the support of an amazing staff, and just my circle of people too. And then trying to create the pockets of joy that that we all need, you know, no matter our circumstance. So
Thank you, Stephanie. Kenna and Meredith, thank you for being here.
Thank you for having us.
And so my grandfather-in-law, he would have said, "You're doing more good than you know." That was one of his catchphrases. And so I think for each of you, you're doing more good than you know. And you may never know. So we have to take just one more quick break. And when we return, Judy and I are headed to the field to talk with one person, hopefully nearing the end of their waiting period. This is Nashville.
Funding for This is Nashville comes from Nobody Trashes Tennessee, the state of Tennessee's official litter prevention campaign, managed by TDOT. Details on how to be part of the solution to end littering at nobodytrashestennessee.com.
In my place, were lines I couldn't change, and I was lost.
I'm Tasha A.F. Lemley, and this is Nashville. This is episode 4 of season 2 of our special series, In My Place. Recently, series producer Judith Tackett and I, we headed out of the studio to meet with one person, hopefully getting pretty close to the end of a long waiting period. Let's listen. Thank you both so much for being here. So we are talking to Nathan Scarlett, an outreach specialist with People Loving Nashville, and Cheryl Smith. You're one of his clients. And we're at Cheryl's, right outside of Cheryl's home at a campsite in South Nashville. So thank you for being on the show.
Oh, it's no problem. I'll do anything to help anybody. I mean, I'd give my shirt off my back if I had to in order to help somebody else. That's just how I am.
Yeah. And you've been in another episode, and really glad to be able to follow up with you.
Oh, I'm happy to help y'all. I really am.
So, Cheryl, how long have you been experiencing homelessness?
8 years.
8 years, all in one stretch?
Yeah.
Okay.
I haven't been, like Connie, she's had an apartment and everything else, and she's lost it, but I've been out here for the longest. Nathan called me the pioneer woman once.
And you've been working with Nathan about how long now?
Oh, what? About at least a good 5, 6 years.
Off and on since 2020.
Okay, so you guys have known each other for a good long time.
Yeah.
Okay. And how long have you been actively working towards housing?
Probably when I started with People Loving Nashville, I would come out and meet with her during the point in time count every winter, but didn't really get a good follow-up until I was able to have more flexibility with my schedule with People Loving Nashville, October of last year.
Cheryl, how have things changed in those last 8 months since you've been working with Nathan?
I've had more hope now. He's given me more hope about getting home. Before, I was like, oh, I'm never going to find a place. And he's like, we got this rolling. And I'm like, oh, thank God, let's go with it. Because I want a home bad.
What does getting this rolling mean? Like, when was the moment you're like, oh, this is actually moving?
When he came and he told me that I was approved, that I was a candidate for Section 8. And I'm like, oh, my God.
So she was selected for the Shelter Plus Care program. So that was 2 weeks ago.
Oh, my gosh. So this is fresh.
Yes.
Do you have a 30-second elevator pitch for what Shelter Plus Care program is?
Sure. Specific agencies have access to Shelter Plus Care. It's another way to get a Section 8 housing voucher, but you just can't take the voucher out of Davidson County. And so after myself would house Cheryl, we are also listed as the agency to provide the wraparound services to help her maintain her housing.
That's fantastic. And okay, here's the big question. Do you have a guess? What's next? How long is it going to take before she walks indoors?
So I just submitted her full 34-page application on Wednesday. So an office member of OHS, Office of Homeless Services, will review her application, and I don't see anything that they would need to kick it back for, and they will send it over to MDHA Section 8. Staff member there will review it, and then the next step is just waiting on a briefing date, over the phone briefing, after they approve her.
How long do you think that might be?
Hoping next month, at the latest July.
Okay, so a month or two.
To get the actual voucher.
To get the actual voucher. And then how long does it take after the voucher to find a place?
Yeah, so in this moment, during the waiting period after going through my 12th year of doing this, I've learned through experience that now is the time for me to start asking those questions to Cheryl, which I did on Tuesday when we got your updated food stamp printout, of where do you want to live? Like, what area of Nashville do you want to live in? She's been very flexible. She says anywhere. Try to usually dive in a little deeper, because a lot of people will say anywhere just to get me off the streets in the beginning. But when it comes down to pinpoint, taking her to those locations and making sure they're on a bus line, it's easy to have transportation. Those are important factors to think about and evaluate.
Cheryl, are there places where you feel like you have more support that you would like to be closer to, friends or family?
It doesn't matter to me as long as I'm off these streets. I don't care where it's at. I mean, just any place would be better than what I'm experiencing now.
We're in this waiting period. Nathan, that voucher, it expires at a certain point once you get it. How long do you have?
Between 60 to 120 days.
Okay, so that'll be a little sprint where the two of you are trying to find the right place. Are you pretty confident you'll be able to do that?
I am.
Okay. And so here we are. This is May, and by mid-July we hopefully have a voucher in hand.
Yes, ma'am.
And by my favorite month, October, you should be indoors.
Oh, thank God. I can't wait.
General rule of thumb, before the end of the year, I would say. We're going to work towards that, for sure.
What are some things Nathan or others could do during that waiting time to kind of, ease that feeling of not knowing?
Nathan's doing everything that he can. I really can't ask him to do nothing. I'm thankful for him. God knows I am. Because he's the only one who really did try to get me off these streets. He will come out nearly every week and check on us. That shows us that there is somebody out there that does care about us and wants to check on us and make certain we're okay.
I like to continue just making sure I'm maintaining a good relationship with the people that I'm intensely working on housing with, and showing them that I see you, I hear you, I'm journeying alongside with you. I'm frustrated by the long process that it takes too, but this is unfortunately how it is. And So with that extra support that the neighbor experiencing homelessness has, that helps them stay encouraged, stay upbeat, stay positive. And that's what I want to be, a light that shines up the darkness.
If I'm not hopeful, imagine what the rest of the camp thinks. I got to try to stay positive for them too. I guess that's part of being a camp leader. I don't know. It's a first on me, but I'm trying my best at it, and I'm trying to keep everybody hopeful. Things might look bleak now, but it's going to look up. It's going to get better.
Well, thank you both so much.
Thank you.
You're welcome.
And thanks to you for tuning in this hour. This is Nashville is a production of Nashville Public Radio. This housing series, In My Place, was created thanks in part to support from the Community Foundation of Middle Tennessee. Next month, we're going to talk about the puzzle pieces that start coming together on the road home, so tune in. Our cover of In My Place by Coldplay is courtesy of Vein Melter. Today's episode was produced and directed by Judith Tackett, and our board operator is Liv Lombardi. Listen back at thisisnashville.org or wherever you get your podcasts. And the conversation doesn't end here. You can comment and tell us what you want to hear on the show by leaving us a message at 615-751-2500. You can also find us on Blue Sky and Instagram and X and all those things at This Is Nashville. I'm Tasha A.F. Lemley, and This Is Nashville. We love you. Keep going.